Hi guys, I'm here for discussing some important topics for your upcoming PG dental exam. So let's start. Which permanent tooth shows all types of vertusi root canal configuration? It's maxillary second premolar. So maxillary second premolar, it shows almost all types of vertusi root canal configuration. Now minimum percentage of change in bone mineralization that can identify in radiograph is 30%. For visualizing any bone change in a radiograph, the change must be in 30%, then only it can visualize in radiograph. Papilloma caused by human papillomavirus 6 and 11, and median rhomboid glossitis is also known as kissing lesion. Let's discuss some questions from brushing technique and brush. In gingival recession and root exposure, modified Stillman technique is the choice of brushing. In patients with healing wound after periodontal surgery, the brushing technique recommended is Charters. A routine technique in patients with or without periodontal disease, Buss or circular method. The most recommended technique in patient with periodontal disease, circular technique. A recommended technique in children, Phones technique. A least effective method, a roll technique. The most common method for brushing is scrub method. It's horizontal scrub method, and this scrubbing technique is causes abrasion of teeth. A two-tone solution, FDC green and red. It stains mature plaque green and immature plaque red. Brush soft, hard and medium. Three types of brush available. For soft brush, the bristle diameter is 0.2 mm or 0.007 inch. And for medium brush, the bristle diameter is 0.3 mm or 0.012 inch. And for hard brush, the bristle diameter is 0.4 mm or 0.014 inch. And for an ideal brush, the length should be 1 to 1.25 inch. And the width should be 5 by 16 to 3 by 8 inch. And minimum rows required for an ideal brush is 2 to 4 rows. And tuft should be 5 to 12 tufts per row. Now the causative factor for Kaposi sarcoma is human herpes virus 8. And the recommendation for dark room, it should be at least 16 to 20 square feet. The wattage of safe light is 7.5 to 15 watt, and it should be red orange range. The wavelength should be in red orange range. The distance should be, when you are processing your X-ray film, from there the safe light should be in 4 feet in distance or 1.2 meter. The normal value of serum potassium level is 3.8 to 5 milliequivalent per liter. The daily requirement of iron in man is 10 milligram. Normal serum calcium level is 9 to 11 milligram per deciliter. Normal level of serum phosphorus is 2.5 to 4.5 milligram. Catechol O transfer is involved in degradation of epinephrine. Specific disease caused by vitamin B1 deficiency is peripheral polyneuritis. Daily vitamin A intake should be 4000 IU, international unit. Fat provides 30% of body calories. White fontanella, slitted eyes, macroglossia, and hypoplasia of maxilla are seen in Treacher's-Collins syndrome. Will's tumor is the most common primary malignant tumor in childhood. Thiamine deficiency causes lactic acid acidosis. The bile acid pool circulate 4 times per mil, and I've seen from net it is written there 2 to 3 times, and from MCQ book 4 times. Posterior ethmoid sinus drains into superior sinus, superior meatus actually. All intrinsic muscle of larynx are supplied by a recurrent laryngeal nerve except cricothyroid. Cricothyroid is supplied by external laryngeal nerve. Enophthalmos is seen in blowout fracture. Paresthesia is one of the commonest finding in zygomatico-maxillary complex fracture due to infraorbital nerve injury. The treatment for a mandibular fracture between the incisor is treated with Risdon wearing. Anterior posterior relation of the jaw is measured by ANB angle. ANB angle refers to sagittal skeletal discrepancy. Sassoni analysis is used to describe skeletal disturbance in a vertical plane. Sedation by which of the following routes can be reversed rapidly? There are 4 options. Inhalation is the route that can be reversed rapidly. Borax increases the strength of agar hydrochloride impressive material. So we add borax to increase the strength of agar hydrochloride impressive material. That was today's discussion. We'll meet in next video.